About infantile hemangioma or strawberry nevus. So infantile hemangioma video stations, how it will be present. It present like a child, average for age. The child has hemangioma, multiple numbers of hemangioma, like in the forehead, back, chest, anywhere. Hemangioma also can be strawberry nevus can be present one side of the face, uh, strawberry color. So infantile hemangioma, the differential diagnosis we can keep like Sturge-Weber syndrome, phases. Phases is short from, it is means posterior fossa malformation, hemangioma, arterial anomaly, cardiac, eye, endocrine, and sternal defect. So phases. Then Klippel-Trenaunay-Weber syndrome. Klippel-Trenaunay-Weber syndrome, that is hemangioma and varicose veins present. Kasabek-Merritt syndrome. Kasabek-Merritt syndrome patient are enlarging hemangioma and thrombocytopenia, coagulopathy, microangiopathic hemolytic anemia. Then capillary hemangioma, cavernous hemangioma, and birthmarks. So the differential diagnosis I am telling of infantile hemangioma. First of all, you can say that Sturge-Weber syndrome, then phases, then Klippel-Trenaunay syndrome, then Kasabek-Merritt syndrome, capillary hemangioma, and cavernous hemangioma, and birthmarks it can be. Now, what are the history we'd like to ask in this infantile hemangioma? First of all, the onset, course, and durations, how long the child is suffering this condition, how it started, what increased and what decreased, and is it started at birth, increase in size, then involutions, then color, any lesion in any other areas, stridor, is hemangioma in the back or genitalia, then any fever and weight loss history present or not, is it affecting the eye, any bleeding, pallor, palpitation and collapse, perinatal history of ventilation, and gestational age. These are the history asking. What examination do in fetal hemangioma? Airway, breathing, circulations, and the hydration status. Examination of the lesion and measure it. Skin around it, any crusting or oozing, borders of the lesions. Then we do the cardiac examination, chest examination, neurological examinations, abdominal for any bruit, eye examinations. And what investigation we do for infantile hemangioma? These are diagnosis by history plus examination and does not require any lab test. So we might need to do ultrasound and or MRI scans on a child who has a hemangioma that is deep near their eye or affecting internal organs. So we are doing ultrasound or MRI scan. Then if needed, full blood count, ESR, urine electrolyte, and blood cultures. Imaging, we are doing the Doppler, ultrasound, MRI abdomen, echo, brain MRI for faces. Others are skin biopsy, search for other hemangioma, intraocular pressure measurement. Hemangioma over the midline of the lower back may require screening for underlying abnormalities of the spinal cord, inner organs of the genitalia. So hemangioma over the midline of, and the lower back. Lower back, we know that spina bifida is one of the lesion. Then we are going, what is the management? Normally, management is most of the hemangioma do not require treatment except in the following situations. Though most of there is no treatment required, the following situations when particularly large or affect the areas where resolution may be incomplete, like the area of nose, lips, and ears. Then, if the hemangioma is ulcerating, the skins are broken. If the hemangioma interfering with the important functions such as feeding or breathing or the development of the senses like hearing and vision. So, important function interfering. Then we give the treatment. What treatment we are giving? Medical treatment, topical beta blocker, that is timolol gel. Systemic beta blocker after consultations of the cardiologist, oral propranolol we are giving. And the steroid we are giving beta blocker contraindicated in asthma, hypertension, cardiac lesion, and hypoglycemia. The interferon alpha, life-threatening lesions, surgical excision, laser biopsy. So treatment are mainly medical treatment are topical beta blocker, timolol gel, systemic beta blocker, that is oral propranolol, steroid we can give, and interferon alpha, life-threatening lesions, surgical lesion, and laser therapy. Multidisciplinary team we are involving is dermatologist, hematologist, cardiology, and plastic surgery. Indication for treatment. Age of the child, not resolved by age. So indication of treatment, hemangioma, that is large ulceration, affect areas where resolution may be incomplete, nose, lips, ears, and eyes, interfering with the important functions, feeding, breathing, hearing, and visions. Complications of infantile hemangioma are ulcerations, bleeding, scarring, pain, and infections. How common are hemangiomas? Hemangiomas are not inherited, but families often say a relative had a hemangioma in childhood because they are very common. So it is not inherited, but family history can be present. Most common in hemangioma are girls, premature babies, low birth weight babies, multiple births like twin, triplets, and quadruplets. What are the advice we give in hemangioma? Some advice we are giving, that is thin film of Vaseline to keep it not dry, not wet. So Vaseline we use, avoid sun, avoid bubble bath, short nails, gentle pressure if mild bleeding or oozing. So advices are Vaseline, avoid sun, avoid bubble bath, short nails, and gentle pressure if mild bleeding or oozing. Thank you.